Hi, this is Dr. David Tenner. We're here at the Goldberg Clinic for chronic disease reversal, and we are joined today by Joyka Farrow. And Joyka came to see us back in November 28th of 2016. Today is March 27th, 2017, so it's been about 5 months since we originally saw her. And Joyka came to see us all the way from England in the UK. What part of England are you from?
London,
The London area?
London, yes.
London.
Yeah.
Okay, so she
Yeah.
came to see us from London. She was actually referred by one of our other patients who came to see us from Dubai, actually, originally. We do get patients from all over the world as well, in addition to patients from out of state in the United States. And Joyka is here for her re-exam, and I'm very excited to share her progress with you. To turn the floor over to you, Joyka. What kind of problems were you originally having? What brought you to see us originally?
Originally it was the general feel of unhealthiness. I felt very low every morning, lack of energy, depressed, and totally overweight, and not liking myself because of the summation of all these issues. And I have to add, having seen the results of Paul's personal problems, which is a friend that referred us to you. It was amazing. So that's how bad it was for me. And well, 6 months later, it's been a big change.
So Joyka originally came in, had a long list of problems, and we talked with her about getting down to the sources of these issues rather than treating her symptoms. We did a fairly extensive workup on her. Thorough case history, physical exam, got some lab work, then had a report of findings with you over Skype to review the lab work with you. And then we got to work. We rolled up our sleeves and got her on a program, put her through what Dr. Goldberg calls Goldberg Boot Camp. And got you doing all the right things, got you doing the right things to support your health. And it's been about 5 months now since we originally saw you. How much overall improvement would you say you've had in percent?
I say for how I felt and how badly it has been for a long time for me, and the improvement I have experienced in the short period of time considering, I would say 80%.
80%.
80% how I felt, and I know that we are, at the beginning, but the improvement is quite radical. So
what kind of things have you noticed are better since?
Well, like I said, that feeling of not wanting to do anything because everything was such an effort every day is not there anymore.
So your energy is a lot better.
Yeah, the energy is a lot better. The will to live is also improved because of that feeling. And the sleeping pattern is better. And the loss of weight also has helped a lot, even psychologically, because being a woman, you feel a lot better yourself when you look better.
As a result of getting healthier, before you're having a lot of anxiety and depression, has some of that lifted as well now too?
Yes, I'm not there 100%. There are a few days that I still have my downs, but obviously it's part of life. But it's not, it's controllable. Well, before I could not do anything to feel any better.
Great. Well, we're absolutely thrilled with the changes and the improvements that Joyka is making. Still plenty of room for improvement.
Yes.
Still got work to do, but
like
at this early juncture, we're absolutely delighted with the positive changes. She came back all the way to see us from England for a second time.
Yes.
So we must be doing something
It's
right.
worth, yeah,
Must be doing
definitely.
something right.
And it's the pattern that I have learned through this system, through the clinic, is changing the pattern of a habit that is really driving you to the bad health. And I've never addressed that before. And because it's personalized to the individual needs,
Exactly.
I think that's how I believe in it. It's the matter of trust.
Yeah, what Joyka just touched on is the fact that every patient is different, each person has different needs, and the path to getting well is going to be different from one person to the next. So in working with her, we developed a specific program for her that was then modified over time, depending according to how she was progressing. So when people come in, we don't have just a canned program to give them based on their symptoms or their diagnosis. but rather we take the time and put the effort forth to work with the patient.
Definitely. It's that guidance and that coaching that I think also works a high percentage of the success rate.
One of the things that I've heard Dr. Goldberg say a number of times is that the true nature of a doctor is to be a teacher
Yeah, definitely.
and to educate people on what they need to do to get them to get well and then to stay well. So eventually, as we progress with Joyka, we're going to be teaching her what she needs to do so that she gradually becomes her own doctor. She knows how to keep herself healthy. So we want her to be independent of all doctors, including us at some point. As much as we like her, we'd like her to be independent, be able to take care of herself, and that's one of the major goals.
That's what you're doing, taking control of your own health.
Exactly. All right, Joyka, thank you so much for joining us today. Thank you for sharing your experience with our audience.
Good luck.
Thank you.